I'm Ben Collins. I'm our Director of System Development for the South East London Integrated Care System. And welcome. Thank you for giving up your time on a Monday evening to give us your thoughts and contributions as we kick off the process of developing a strategy for our new integrated care system. Now, as we go through the process, we'll talk a little bit about our ambitions for this evening, our ambitions for the strategy, and there will be huge opportunities for you to contribute. But before we get into that, can I hand to my wonderful colleague, Paul Nazarek. Paul is one of 3 wonderful new non-executive directors for our Integrated Care Board. Paul, I was hoping you might say a few words of welcome and introduction, and perhaps say what you're hoping to get from this strategy development process.
Thank you, Ben. Great to see you and the team, and great to see so many people on the call this evening. So let me begin by echoing Ben's point about a huge thank you to everyone who's shown the commitment to join us this evening and contribute to what's an incredibly important process. It's a huge. I'm pleased but not surprised that people have, because it's a really important opportunity for the system. Obviously, I joined formally as a non-exec director on the 1st of July when we formally came into becoming a legal entity, as it were, as an ICB, and so this is an incredibly important opportunity as a new system to make a mark and to really think about how we want to do things differently in South East London for the benefit of the health and well-being of all our populations. So it's a brilliant opportunity to develop our strategy, our vision and our direction for the next few years. So hugely excited to be part of this conversation this evening. In terms of things I hope we might get from the conversation, I'll be looking for a couple of things. One, really interesting that we see if we can get a breadth of the issues that we cover, ranging from the wider determinants of health, things like jobs and incomes and so forth that affect people, that cause ill health so often or can help good health. Also, of course, interested in service integration and how our services work differently together. But lastly, and very importantly for tonight, I think, so important to get the contribution of our community recognised in our strategies. What can we all do as individuals? What can we all do as communities to support healthy lives in South East London? So I hope we'll get those range of issues covered. And really tonight will be brilliant if we also get a diverse range of voices in the room. So that's such an exciting part about this evening, that hopefully we've got people from all our places, from different communities in South East London. It would be great to get that challenge into the conversation of the different voices in our communities in South East London. So really looking forward to the conversation. Ben and colleagues, thank you again for joining this evening, and over to you again, Ben.
Super, thank you so much, Paul. And what you say really resonates with me. We know that, the broader that we are in terms of how we engage and think creatively together on our strategy, the better it's going to be. So thank you again, everyone, for joining now. So the objectives for today's session. We want very briefly to explain the recent changes to our local health and care system, because as Paul mentioned, we are a newly born integrated care board and integrated care system as of the 1st of July. The purpose is not to spend long talking about those institutional changes, but just a very quick introduction for you in case it's useful. Then we want to share our ambitions and our current thinking on our approach to developing our strategy. So one of the big things we now have to do as a statutory integrated care board is develop a strategy for our system. We want to talk about our ambitions and the process. And then the really important thing is we want to gain your input on what we should focus on and what opportunities we should explore. So we'll start with, we've done some welcomes, introductions and housekeeping. We'll start with setting the scene. We'll spend a bit of time talking about the vision. Where are we heading? What would a really great health and care system look like? We'll spend some time reflecting in groups on the big opportunities that we might exploit in our strategy to really deliver a step change in the quality of care for local people. And then we'll have some time for closing reflections and next steps. And as well as Paul on the call, I'm very pleased we've got our Chief Executive, Andrew Bland, and the Chair of our Integrated Care Board, Richard Douglas, who we'll turn to for some closing remarks. Let's get into the meat of our conversation by just briefly setting the scene about our ICS, and then we'll get into what we're hoping to achieve with our strategy. So if we go to the next slide, we are on our 25th day of existence as a statutory integrated care board, and on the 1st of July, we closed down the previous organisation that was responsible for planning services and allocating resources, our clinical commissioning group for South East London, and we created our new integrated care board with responsibility for planning services. And our mission is to help people in South East London live the healthiest possible lives. And we're going to do this through, number one, helping people to stay healthy and well, providing the right treatment when people need it, caring for people throughout their lives, taking targeted action to address health inequalities in access and experience and outcomes of care for particular social groups, and excitingly, by supporting resilient and happy communities, and not just delivering healthcare, but trying to find ways of using our resources to support the social and the economic strength of our communities. And we think there are a couple of really exciting new opportunities in the new system that we've created to make faster progress. Our new system is all about partnership working, combining resources so that we can tackle the really big issues facing local people. We want to work as a system of systems. So we're a big, complex system with hundreds of organizations and 100,000 staff. We're not going to do that as a top-down hierarchy. We want to empower staff and partnerships in our system to lead change. We want to work in stronger partnerships with local people, and that's what this evening is all about. And we want to focus on getting better at innovation and improvement. So here is we're going to go to a very quick minute or 2 minute video on our new integrated care system. And I can just see a hand's gone up. I'd be really grateful if there are any comments. If you could post them in chat for the moment, that would be really helpful as we get through this next bit.
From the Catford Cat to the Brixton Windmill and Chislehurst Caves, South East London is a vibrant, fun, unique place. Local people need different services depending on their circumstances. If you are parents of a young family, you might need help ensuring your children have the healthiest possible start in life. If you are middle-aged and have started to suffer from asthma or heart disease, you might need help to stay fit and healthy. If you are an older person, you might need help to live independently. Local people face different experiences and health outcomes based on where they live and other factors. Our current health and care services aren't always designed in a way to meet these different needs. Most of the services in South East London focus on treating people when they get sick, rather than helping people to stay healthy in the first place. We have lots of different services, and we have sometimes struggled to coordinate them and make the best use of staff and resources. If you have several problems, you can visit lots of services, retelling your story, getting different advice, rather than getting support from one joined-up team. We've worked with colleagues to improve health and care services for a number of years. There is still a lot we can do to strengthen this partnership and better the care within your neighbourhood, your borough, and across South East London. Introducing our integrated care system, a partnership that brings together lots of organisations that are responsible for keeping people healthy and well. If we work together, we can intervene faster and earlier to keep people well, making better use of specialist skills and equipment. We can offer more joined-up support for people facing significant challenges. This way, we can address problems faster and develop more effective solutions for local people. We will be working with local people and communities to understand what's important to them, so we can tailor our work to what local people want and need.
So we're all about partnership. We're all about getting upstream and prevention and addressing people's problems earlier. And we want to pool our resources and join together care to strip out some of the complexity and duplication that we have across England in our services. Now, before we get on to the strategy, of course, you know, the one big feature of the context, of course, right now is that we are emerging from a major pandemic. And this, of course, shapes the challenges that we face in our system. You know, people's health needs have worsened. Children and young people are struggling. We have long waiting lists for services. But it's also, in a way, gives a sense of hope in so much that, you know, the way we worked together in the pandemic was often really inspiring. The way health and other public services, the voluntary sector, and our communities joined forces to tackle some really, really big challenges as we rolled out vaccinations and shielded people during the pandemic. So before we get into the strategy, I was going to ask Lucy Perry, who's Deputy Head of Nursing and Quality for South London and the Maudsley Mental Health Foundation Trust, just to give us just a couple of minutes of reflections on working through the pandemic, and in particular, you know, what are the issues from the pandemic we should be aware of, and what should be bottled in terms of how we work together.
Lovely, thank you, Ben. Thank you all for the great opportunity to be able to speak to you about my experiences around working as a frontline staff during the pandemic. So working through the pandemic, as we all know, was a very new experience for all of us, especially myself as a nurse. I know a few of my colleagues had been through the pandemic, different types of pandemics, like the flu pandemic or the Spanish flu pandemic, but nothing could have prepared us to the level of scale in which COVID was presenting itself. It was a challenging time responding to staff and patients' anxieties. And really, there was a lot of fear, which was written not only in patients' faces, but all over staff faces. And one of the ways as a senior nurse that I could help was to be able to just role model, care for patients who were testing positive, and just be able to provide that staffing gap for services that were experiencing staff shortages because of staff having to test positive, or people having to be off sick because they were caring for a loved one. So as a whole, the organization, we felt that we were not prepared emotionally and physically for the impact that COVID would have on staff, on patients, and the community at large. We also, in the news and everywhere else, being broadcasted about the lack of equipment that we were experiencing. There were serious staff shortages all over the place. And of course, you know, because it was something new to everybody, and most of us had not lived through a pandemic, guidance was really coming through thick and fast every single day. And it meant that we were having to rely heavily on guidance coming through from central government, the daily evening news, or the live broadcast that Dr. Chris Whitty was giving out every evening was really important for us, just to be able to get to know what was going on on the ground, or as a community at large. But we found really that most NHS organizations responded very, very quickly to the pandemic. And I found that working from home was introduced very, very quickly, and patients were not left to a certain degree, particularly in mental health. We started to introduce virtual appointments, and most of the patients were being seen. And I know that some of the patients within the acute medicine, they had appointments cancelled. And, you know, it really did bring about a lot of anxiety. So it was a really tough and challenging time, not just for people who were working in the front line, but for the whole community at large. But through all this, what we saw was a lot of resilience from staff, and staff will continue to work very hard, maintaining good standards of care and providing good outcomes around safety and all the right care work that we had to do, as well as all the key performance indicators that we are expected to produce on a regular basis. So what we got from COVID as a whole is really around ensuring that, you know, we really understand that we need to always be prepared for pandemics. As a country, as an organization, as the NHS, we need to always be ready and prepared and ensure that we have enough resources to be able to support our organizations and the frontline staff. And one of the things that we appreciated that came out of it was around the appreciation of work-life balance and being able to understand that spending time with family was just as important as being able to be at work. And also looking after one's physical health was one of the things that I really managed to get out of the pandemic. And also it was really important around the partnership working that we you know, as an organization, we evolved and we identified that there were different ways of working, and we had to increase effectiveness by sharing knowledge, sharing experiences, sharing ideas, sharing resources, you know, ensuring that patient-centered approach to care was being offered, not just to people within the hospital settings, but also within people within the community. And, you know, partnership working has also provided greater opportunities for staff development as well. So that's a little bit of some of my experiences of working in the front line.
Lucy, thank you so much for finding a little bit of time to share that with us. I mean, I'm conscious it was a hugely challenging period. You know, I had elderly parents in their mid-80s coping during the pandemic. It was hugely difficult for local people and for staff, but thank you for giving those reflections. And as you say, there is a sense that amid some really significant difficulties, you know, that on some things we work really well together in a more flexible partnership than the NHS has sometimes had in the past with its partners. And that's one of the things we want to bottle and to keep to take into the new system. At that point, we need to move on, and I'm very pleased that Andrew Bland, the Chief Executive of our new South East London Integrated Care Board, is here with us. Andrew, if you could put your camera on, if it's not on already, and I was hoping that you might share a few of your own ambitions and objectives for the strategy process, and then tell us a little bit about the process that we're going to be following up until the end of the year. Andrew.
So Ben, thank you very, very much, Ben. As the slide says, Andrew Bland, I'm Chief Executive of the South East London Integrated Care Board. I've worked in South East London for the last 13 years, and one way or the other had a chance to interact with most of the, well, actually, with all of the boroughs and most of the places and institutions in them. So that's me. Ben, I think in these sort of modern times, using Zoom and Teams and otherwise, it's quite instructive. You can see perhaps what your audience is thinking through the chat as well. And I've been keeping an eye on the chat. So one thing I wasn't going to say, but just to be really clear, we're facing some huge challenges, and that is a backdrop for some of these conversations. Recovery from a pandemic kind of presupposes that there wasn't anything wrong before that. Inequalities were rife, as far as I can see, for our population. We did have issues with access, performance, and quality. And money's the challenge. So those things have been exacerbated, and we've learned a lot about them. But let's be clear, we're aiming for a strategy first and foremost that lives to our values and our mission, that we are seeking to make improvements for people. So let me say that up front. So some of the stuff I was going to say, well, why is this important to me? I was thinking about the pandemic, and it's great to hear some frontline experience. And you'll appreciate I'm not a clinician and was not on the front line, but took a lot of learning, I think, from the pandemic and the vaccine. Why was that? And why did people come together so readily? We had a core purpose and something very clear to come around that we needed to achieve. Vaccinations, in that case, as quickly as possible, targeting the most vulnerable first. very simple and clear messages that people can come around. And of course, in a pandemic, that's kind of unique. So how do we achieve that level of clarity? I think one way we do it is by this type of engagement and making sure we listen to all the voices. The slide, if we can go to my first sort of main slide, I'm not going to read out, but did want to pick out a few things from it. You probably hear a lot from myself and our chair, Richard Douglas, and other board members about being different. And it's kind of in this space, not for the sake of it. So I said I've been involved in South East London for the last 12 or 13 years, and as a result, responsible for some of the strategies that we put forward. And this one does need to be different. But just to be specific about that, we produce strategies that respond to somebody else's agenda quite often a national agenda that we've tried to overlay in a place like South East London, which we know is unique. So we can't do that again. It needs to be born from what's happening to our residents, and respect the fact that, yes, we have a national health service, but we must find a way to live in both of those worlds. So it can't be about somebody else's view. We've also produced strategies that if I'm really blunt about it, have been almost predominantly focused upon money and how we live within our means and what we happen to have at that point in time. And again, we can't do that. And one of the reasons we can't do that is that even if I had money at the moment, I don't have the workforce to spend it on. And I don't have some of the innovation in the bag that allows us to spend that money in a really wise way. So we can't do that again. So it must be different. And really, really important, Lee, and to the heart of an integrated care system is that we've produced strategies that are just about the NHS. And I'll come to the conclusion those strategies are probably self-defeating if they're aiming to improve people's health and well-being, because the NHS does great things, and I'm absolutely clear on that. I've only ever worked for the NHS, and I'm absolutely wedded to that idea. But it's an expensive way to do things if you wait until people fall ill, and it's a narrow way of doing things if you expect to make people's lives that much better by only treating them when they fall ill and only looking at the things the health service can do. Leisure, fear of crime impacts people's mental well-being, and so on and so forth. So solutions beyond the NHS are things I'm hoping from our strategy. So that's the first thing, difference, really important. Secondly, we must have some new ideas, and I find that these type of engagement events are where those are usually born from. So for me to say that workforce is an issue, and we need a readily available workforce, in the full knowledge that we won't have one tomorrow or the next day, implies that we must have some different ways of thinking about doing things if we're going to address things in the near term and longer term as we develop that workforce fit for the future. Just to use one example, so it's an innovation. I'm hoping that we'll have new ideas to focus on here. I wanted to just talk about us not creating a telephone directory of all the plans that we've ever wanted to undertake in one place. We're a partnership, and whether you're King's College Hospital, the Foundation Trust in Camberwell and out in Bromley, or if you are a general practice or otherwise, you have some degree of strategy already determined and a way in which you want to do things, and that's great. We're looking for those things that we can have maximum impact by coming together as a partnership on. And as I say, those will be a partnership of people who live in South East London and those people who work to try and make things better for people who live in South East London. So targeted things, those things will have greatest impacts and can be achieved better because we've worked together on them. The third thing I wanted to talk about, and I hope this is true, I don't imagine you became interested in the local health and care system because we put on an event. In fact, I think it'd be insulting to assume that. Certainly I've been interested for longer than we've been talking about this strategy. So really to build on things that we have been talking about or that we have been trying to do for some time, and make sure we do not in some way start afresh with these discussions and are very clear and recognise that. And the final thing I wanted to say about my ambition for this strategy is that we have good institutions, and we have institutions that are good at focusing on those institutions, and I would defend that's good. So what this strategy needs to be about is something else, and for me it's populations of two kinds. Either populations defined by where you live and where you live your life, and that very often won't be a borough, but it might be a ward or a street even. It may be Peckham, not Southwark, or Brixton, not Lambeth, or Catford, not Lewisham. I won't go through all of the boroughs, but you get the idea. Or it's a population because it's a population of people who have very similar needs. They might be the frail elderly in our society. There might be children, young people who are now experiencing bigger issues with their mental health and well-being, or there may be people who are currently suffering from cancer and on a cancer pathway. So really a relentless focus on the population that we're serving and how we can do better for them together, and not just as the NHS, I should say the NHS has often done, focus upon what institutions can do for themselves and for their patients. So just some messages from me particularly. Hidden at the bottom of this slide is also a sort of a nod to, the next slide, so is a nod to other ways in which you can interact with us. And so I do want to make really clear that yes, we're having a discussion this evening, but we want to find other ways to be in contact with people more locally through the websites, if that's how you like to interact. If we can go to the next slide, and the last one for me, actually, Ben. So Ben asked me just to say a little bit about the process, and in some ways, it's straightforward. We're looking to have an initial conversation now, and in events like this one, we had one last week, there's another one later on, slightly different audience on Thursday, and to make sure we get into a conversation that starts with one of the biggest challenges, and hopefully some ideas on solutions with people with as wider spread as we can achieve. And then very deliberately, as we get out of that sort of area, to continue to engage people on, well, how do we decide on those priorities? I imagine we'll have a whole range of views as to things we might make improvements upon. Some will be dealt with by people already in the system. Others will be new and we need to turn our attention to them. So we'll be looking to go to those areas. I'm very sorry, but my the screen for me is not very clear at all. I don't know if others are struggling. The third is into September and into the autumn, where we're having engaged and having found out about those things that people find most challenging or see most opportunity in, and with an idea of our priorities, what best works in making a difference. And that will be a blend of engagement like this, but also drawing on evidence, best practice, other people who've done it better than us bluntly, and again, getting into working groups and different views as to how that works, such that we can get to sort of Christmas time where we are bringing together a strategy, which again, with each of these stages, and especially that one, we're able to play back to people who've taken the time to engage with us and say, well, did we hear this right? Are we along the right path? Are we shaping things up in a way that we intended to? So Ben, if that's okay, I was going to stop there, having said a bit about my some hopes and wishes for the strategy and a bit about the process as to how we'll get there.
Super, that's really, really helpful, Andrew. Andrew, if you could stay online and keep your camera on, can I please introduce Falake Segun? And Falake is our wonderful director for South East London Health Watch, who helps to bring the voice of patients and the public into our work. And also James Lowell, and James is the recently appointed executive director for our local care partnership that oversees community-based services in Southwark. James, could you put your camera on too? And we'd like to just spend the next 10 minutes getting any quick reactions and questions for Andrew, Falake and James on our ambitions for the strategy and the process that we're going to follow. So if you could go to Mentimeter, so go to another another window in your web browser or on your mobile phone, and just answer this question. Do you have any questions about our plans? Would you like to share any reflections about what's important to you? And we'll try and pick out a few of these as they come in. But while people are doing that, Andrew, Falake and James, can I get your thoughts? What's most important to you as we develop this strategy? And what would success look like at the end of the process? And if I can start with Falake, and then I'll go to James. And Andrew's already talked a little about this, but perhaps Andrew, you can tell us a bit what success would look like. So Falake.
Thank you, Ben. Rather than just say what I think, I'd like to draw on the intelligence that we've collected as Health Watch. So it's what people have told us, what the public have told us. And they've said that they want to see really good, inclusive interventions and preventative strategies. So things that help people stay well before they fall ill. People have said over and over again that they need their voices to be heard. So we want to see and reflected in the strategy, people's voices being listened to and taken into account, so that we aren't talking about another review in a few years' time. We want to see really that no one is being hard to reach. It'd be great if we could lose that term so that the outcomes that come from the strategy. So when the priorities have been decided and the outcomes are shown, they apply and are good outcomes for anyone, irrespective of where you live, but also irrespective of who you are. So your gender shouldn't matter, your ethnicity shouldn't matter, your sexuality shouldn't matter. You know, we really tackle those inequalities head on. I think we'd also like to see a real difference in access. So, you know, fewer challenges around the accesses around services. And that's sort of a summary of what we'd like to see and what people have told us as HealthWatch in the strategy.
Super, thank you, Falak, and it really chimes with the points coming up on the screen from Menti. James, are you there?
I am. Thank you, Ben. Thank you, Falaki and Andrew, and for all the comments and questions. I think there's a number of things for me. I think Andrew really said it earlier when we spoke about this being a strategy that we developed together across all the different people that live in our boroughs, work in our boroughs, and different organisations. I think as you saw the timeline, it sort of went on to the end of the year, and for me, it felt like potentially could be a sort of old, you know, a bit traditional sort of engagement piece, but actually it's more about what next after that. This is the first step, the first stage, and we're going to constantly be developing the strategy together. And I think that's so important. We spoke a little bit about, and we heard how this feels different. And actually it's really about the objectives and the wants and the needs of the people that live and work in our boroughs, rather than what we're being asked to do, a list of 10 or 15 things maybe by central government. And whilst it's important to understand what you know, governmental pressures or asks are, I think really engaging with the people that live and work in our communities has got to be at the forefront of this, and using the voices from all the organisations that are part of the systems. So I see the voluntary sector has been mentioned a lot, and I think it's been a real deliberate attempt to make sure that voluntary sector organisations are absolutely included in, I've got a strong voice in how we develop these strategies, and quite crucially listen to those voices where they've got solutions, potentially for some of the problems we've had for a long time, and maybe we just weren't structured to listen to them well, or actually take those solutions on board and actually do something meaningful with them. I think if you were going to ask me what success might look like for the future, hearing what people want from our strategy and how health and social care can be delivered differently, and then people really seeing we've actually made a difference in the things that matters to them, so we can recognise some of those things that people want us to do in future years, to say that we've actually started delivering to make these changes, so we recognise that, and it's not just a strategy that looks great, but it starts to deliver real tangible change for people who live and work in areas at placement across the system. So if we can achieve some of those things and really make sure people are included, getting their voices heard, and also all the organisations involved in delivering change, I think we're really on the road to success for this.
Super. Thank you very much, James. That's the challenge, isn't it? Not a strategy that looks lovely in a nice published document at the end of the year, but a tangible change and progress. Andrew, leaping forward, what would a good outcome look like for you? You've already said a little bit about this.
Yeah, so Ben, I've kind of said what good would look like for me, but it just just add one thing, which is more around the process and how we get there, as opposed to the outcome of the strategy. I'm hoping that we'll understand more about each other off the back of this. I think one of the inhibitors of partnership working is assumption about what people want or don't want, assumption about people's motivations, assumptions that we are pulled in different directions simply because of different national policies or otherwise. So I'm hoping the process might help us learn more about each other, motivations, and what needs to be done. But a working assumption, by the way, that we'll find more that sort of unites us than divides us, to be really clear. I'm also hoping that this engagement and the bottom-up approach is a nod to and cement to sort of how we do things around here. So it's all very well for me to say I would like it to be different. I don't want it to be different once. I like it to be different in terms of the way in which we conduct our partnership going forward. I think finally, and just to sort of amplify it, I would like to see a couple of golden threads through here, and our mission speaks to it slightly. We do want to improve outcomes. We do want to look beyond the health service to do that. We really definitely must understand and then address inequalities facing our residents. And so if we don't see that here in the strategy, I think we've failed somewhat. Is that okay, Ben?
That's really helpful. Now that the comments have been streaming in, and I've been straining to catch as many of them. Conscious of the time, I want to be very clear. Everything you say here, we will spend time reading through and thinking about. But conscious of the time, I want to pick up 3 of the questions for our panel before we move on. So, and I will give you, some of you, a chance to think about them. For Lucky, people are asking how we can find a way of really meaningfully involving vulnerable people in the development of our strategy. And we'd welcome your thoughts and reflections, advice on that. James, you mentioned this. People are raising how we ensure that we develop our strategy in genuine partnership with the VCSE. And that's really close to my heart because of the inspiration and the alternative ways of thinking that the VCSE can bring. I'll be grateful for your thoughts on that. And Andrew, this came up in our last session on Friday. As well as developing a strategy and translating it into action, how are we going to make sure that we can measure the outcomes from our strategy, and how can we involve local people in this? So Falaki, how do we really stay true to our commitment to involving the most vulnerable in this process?
I think the word you used first was meaningful. So the engagement has to be meaningful. And for me, that means that the engagement has to be given time. So we need to move away from some of the more rapid ways of which we come to decisions. Because if you are trying to talk to people, you need to meet them where they are. So there shouldn't be all the expectation that, you know, people can come to a meeting, although we are at a meeting this evening, but there should be many different ways of engaging with people. I think that's part of it. I think we need to give ourselves time to actually build relationships and to work through trusted partners. So this is where the voluntary sector has a really strong handle, because they work with communities, with very often with people who don't often get a say in the decisions that we are making or in the conversations that we're having. I think it is really important that as providers and commissioners, when you do start to engage more and more, it has to be frequent. That should be the other thing. It can't be helicopter come in and then leave and go off and do something. But there needs to be a real acknowledgement that you are hearing what people say. And it's different to listen and it's different to hear, but you are hearing what people say and then taking that on board, responding and being transparent about decisions as well. And then coming back to people when decisions have been made either way. So yes or no, but with a clear understanding of why. And I think that's how we start to build relationships, ensure meaningful engagement, and to bring more and more people and increase the diversity of voices that are involved in how the plans and services work.
Super, thank you so much, Falaki. And yes, as you're saying, this has to be the start of the conversation. James, we're blessed with the most incredible VCSE sector in South East London, but sometimes I feel it sits a little bit apart from the NHS, doing wonderful things, but slightly separately. How can we bring it in more fully in this strategy process?
And I think it builds on Falaki's point about really understanding and listening. So I think first and foremost, it's really important to understand that the voluntary sector in itself is as complex as the health sector might be or the care sector. So there's not one voluntary sector organisation or umbrella organisation. There are large organisations and there are really small ones that, you know, look after small communities or particular issues. So really understanding a neighbourhood and a place, and what's in Southwark, what's in Lewisham, what's in Lambeth, but also what does span across South East London is really important for us. Because if we assume that we can engage the voluntary sector just by saying we're going to do that, and then that magically happens, I think that's the first mistake we would make. And I know in the past other areas have done that to involve the voluntary sector and expect voluntary sector organisations to be able to engage with us as you'd expect huge organisations would. So really not wanting to take that away and really understand how we best engage with all the voluntary sector organisations to build those resilient communities. Because really this is what it's about, is making sure that the right people that are going to deliver services and help our communities, either at scale across South East London or even one particular road in Lewisham, for example, really get the opportunity to do what they're good at. Understanding we don't have the monopoly on the best way to deliver services or build those resilient communities and wrap around particular service users or people in our communities. So really through our place-based directors and those partnerships we've got in place, really understand what's happening locally around our sort of neighbourhoods, and how do we make sure that people have got a voice? And then crucially, how do we ensure that the right amount of resource goes to the people that are best placed to deliver those services? And then they're always going to be traditionally like the big organisations, health or social care, and a lot of the time it sits for the local communities to build those resilience around the people that live in those areas. So really to think through how do we do that in a supportive way that's not really short term as well. Because I think previously, sometimes we've engaged with voluntary sector organisations, we've done it on a really short term basis for particular issues or over a short period of time, and actually thinking about if this is what the local communities want, and this is how they want to receive that care and that support. And we've got, it's incumbent on us to think, how do we make that happen and how do we make it work? I also think having voluntary sector organisations being represented at all the place-based execs is really, really important. And how do we make sure we've got that voice in all the decisions we take, not just engaging voluntary sector organisations in delivering, but actually making the decisions alongside all the other partners and at place. So we really are hearing the voice of the voluntary sector. I think all those things are really key for me, and we've learned those over a number of years.
Thank you, James. Really, really helpful. And as you say, this South East London strategy is just one of the routes into building the partnership with the VCSE. Andrew, in 15 seconds, we do need to make sure that as well as engaging both on the strategic priorities and the solutions, that we also engage the public and demonstrate the outcomes that we've delivered from this process. Very quick thoughts.
Okay, well, not to start on the negative, Ben, but the NHS part of this partnership is going to have to unlearn a few decades of chasing process targets and those associated with specific timings of things happening. And so let's just be clear about that. I guess then to ask the same group of people to do the same thing again and expect a different result isn't particularly clever. I've been really taken over the pandemic, and people will correct me as to when it exactly started, our South London Listens work, a real broad engagement of people who don't do the types of role that I do, but a diversity of view and asking people what they value or would see as valuable outcomes. I think it has to be built into part of this process. And I also am very, very doubtful that we will get a good conversation concluded on outcomes in the timescales we've been talking about. So I think this strategy is going to be about direction of travel and prioritisation and commitment to engaging people on outcomes. I've gone way over 15 seconds, but just to say one final thing, Ben. If we learned nothing else from the from the pandemic period and the vaccination programme as well, they've got to be localised and they've got to be culturally relevant and appropriate. And so we've got an additional challenge that it won't be assets of outcomes you can just overlay for the South East London population. I think we may have a strategic intent in one area and then have to understand it in several different ways, depending on the populations that we're trying to relate and do better things with.
Super. Thank you, Andrew, and thank you to Falake and James. We need to race on, but we'll capture everything that you've said and reflect carefully on it. Now, one of the things that we do want to capture in our strategy, if we go to the next slide, is a vision, a statement of what a really good health and care system would look like for South East London. So if we can go to the next slide. What we mean by a vision is a high-level description of the sort of healthcare system we want in, say, a decade's time. What will it look like? What will it feel like for service users, staff and communities? And crucially, how do we want it to be different from the health and care system that we have today? Now, personally, I'm a bit jaded about strategy, about visions in different organizations. They tend to set grand aspirations for the future. But the reason why we think a vision is really important is to get a broad agreement on the direction of travel for our system. Where do we want to focus? How do we want to develop our care? We've got a very, very complex system, hundreds of organizations, thousands of staff. We need a framework so that we can test new ideas in the years ahead. And we want to empower our staff to go out and make change on their own. We want to help them to do that without waiting for permission, but to make change in a way that's broadly consistent with the overall direction of our system and the sort of care we want to deliver. So if we go very quickly, we're going to race through this bit, go back to Menti. Can I ask you to imagine it's 2030? We've got a wonderful health and care system. What does it look and feel like? What are the most important things for you? Let's see what people will say. So go back to Menti and we'll see the next question. Imagine it's 2030. South East London's got one of the best health and care systems. What does it look like and feel like to you? And this will help us as we home in on the things that really matter and the choices and trade-offs that you have to make to get a great system. And we will start, I hope, to see the responses popping up. So simple access to GPs, face-to-face, accessibility, a system that places the emphasis on prevention rather than the cure. That's really something we're thinking very carefully about. It's something that we've promised in health and care systems around the world for a long time. How we ensure equity for everybody. And one of the things we really want to get into in the conversation is where could we most improve equity? What are the practical things we can do? Because we all subscribe to the ambition. Ensuring accessibility, digital for people who want it, face-to-face, I guess, for those who don't. Strong relationships and ways of working with the VCSE. Avoiding a postcode lottery, that's really, really valuable and interesting. Services that listen to patients and don't discriminate and don't push them away. So how can we get more culturally appropriate services and services that are respectful and caring for all social groups? How can we ensure that citizens and communities are equal partners in the development and delivery of services? That's a major preoccupation for one of our new non-executives, Anu Singh, who's focused her work on patient-powered health. How can we ensure that most care is delivered in the community? This is hugely interesting, isn't it? I mean, for me, with my parents in their mid-80s, they spend most of their week traveling to different appointments and often for very long distances, and they're struggling to drive. How can people be empowered to look after their health and find their way quickly to get good healthcare? That's really interesting. Both the empowerment point and the finding your way through our system point. And one of the things that I find as a carer is that even though I'm a professional in the system, I also find it really hard to understand what's going to happen next. Where do my parents go for the next thing? GPs plugged into expert diagnostics and support, that's really interesting. We've got real challenges in primary care that we will need to discuss in the breakouts, but how could we support the primary care system better and take some of the pressure off them? Super, look, that is hugely helpful and genuinely exciting in terms of the ideas that people are raising. Can I suggest that if you haven't put your comments in, please carry on, but we're going to move on because we're a little bit tight for time, and we'll reflect on everything you've said over the next few months as we think about our vision, a statement that's going to be a useful statement of direction for our system. But the other really big thing that we want to do in the strategy, we want to set out the vision, that's useful, but the really big thing is to home in on a small number of really big strategic opportunities, areas where we could have a big impact across our system. And if we go to the next slide, I'll briefly introduce this conversation before we go into breakout rooms. So we want to home in on 2 or 3 really big opportunities, things that if we got it right, would deliver a step change in the quality of care for our local communities. And we're thinking specifically about concrete, practical opportunities to improve care for local people. so that this strategy stays focused on things that really matter to our communities. And we're using a few tests. You know, there are so many things that any health and care system in England or beyond wants to do. But we're going to have to home in on a few things so that we can put the resources in and really deliver them. And we're going to use a couple of tests for working out what the best priorities would be. And the first test is the size of the opportunity. Would addressing this problem or opportunity deliver really substantial improvements? Could we dramatically improve outcomes, efficiency? Could we really address inequalities? And the second big test is this a problem or opportunity where different parts of our system really would benefit from working together? Because as Andrew said in his section, we don't want to develop a strategy that covers everything that's happening in our boroughs or in our individual hospitals and providers. We want to home in on areas where, as a partnership, we can do something differently together. So to get us into this conversation, we would like to present 5 areas just to kick off the conversation, just to kick off the discussion. And these are based on the previous conversations that we've had with our communities on strategic priorities, including in 2019, conversations with staff within our system and our review of the data on what's going well and what's going less well in our system. It's also influenced by what you told us when you filled in the forms to register for this event. So we're proposing 5 initial areas for conversation. They're not our proposed strategies and priorities for the strategy. They're just the starting point. We want to test these potential areas with you. How important are they? What would the big opportunities be? And later on, we're going to give people a chance to say, well, I think you've missed something really important, and to put that down on the table as well. So we'd like to have a conversation about prevention and health and well-being. We know there's a huge amount we could do to prevent ill health and increase efficiency if we could be more rigorous and systematic in applying preventative healthcare, vaccinations and screenings and other tests, if we could help people to live healthier lives. We know that children and young people in South East London are struggling with a significant proportion with long-term conditions and a large need for mental health and emotional well-being support. We know that people are really concerned about access to primary care and access to face-to-face primary care when they need it. So we need to think about how we can tackle these issues in primary care while facing really quite substantial workforce shortages. We know that many people in South East London have got complex needs. They might have one or more chronic long-term conditions. They might have mental health needs. They might have social needs. And we're thinking about people such as the frail elderly, families with particular challenges. How can we join up care for these groups of people with complex needs and keep them, help them to live the best possible lives in their homes? And then finally, we know that there is very high need for adult mental health services in South East London. There are long waiting times to access some of our services, and there are high levels of distrust amongst some parts of our community in some of our services. So there again, we think it could be a really fruitful area for our strategy. But we are now going to break out into half an hour breakout discussions. And we want you to choose on the screen here. So hopefully there will be an opportunity popping up that will allow you to select which of the rooms you would like to see, you would like to join, whether you want to talk about prevention, health and well-being, children and young people, access to good primary care, people with complex needs, or adult mental health. And well, welcome back, everybody. I was in the middle of thanking and giving some final thoughts to my group, and then the guillotine swung and the conversation stopped abruptly. But we had a really good, enjoyable conversation, and I'm hoping, Chloe, is everybody back in the main plenary session now?
Yes, everyone's here.
Well, I have to say, I think that I won the jackpot with my conversation with around 10 people on primary care. It was really, really fascinating and constructive and useful, but there was some difficult listening in terms of the challenges that people are facing that I'm very grateful for. What we'd like to do now, we need to be conscious of the time because we don't have too much before we finish, and it's now late into Monday evening. We want to spend a little bit of time just feeding back on those breakout conversations and making sure that we capture all of the main points. What I would like us to do is, could we go to Mentimeter? And could you answer what was the most important theme for you in your breakout discussions? So what was the most important theme for you in your breakout discussions? And while you're doing that, I would like the facilitators for each of our breakouts just to give me the 2 or 3 really big points that resonate most with you from your conversations. And maybe we could start with Sarah on prevention and health and well-being. Sarah.
Thank you, Ben. It's really difficult to summarise it in terms of a couple of areas because we had a really rich conversation. But I think key themes I took away with me were the real importance of thinking about local tailored offers, community-based offers that take services to people rather than the other way around, the importance of information and education to help self-care, but also particularly helping people understand symptoms to identify and manage risk early. We talked about targeted support for particular population groups and a variety of offer. Digital will suit some people, not others. And the real importance of local authority and NHS joint effort, but in a co-production with people and communities, not one way round. And really needing to think about better involvement of lived experience practitioners, voluntary sector, carers, and to signpost to help people with things like housing, which is so fundamental when you think about wider determinants of health and issues. So just a few of the themes that we have captured more broadly, but hopefully a helpful summary.
Really helpful, Sarah. And it just strikes me, we were reflecting upon this earlier today, we've been talking the talk on prevention for a long time in the health system, in England and beyond, and we really struggle. It does strike me, Sarah, that it's that partnership with local authorities and the VCSE might allow us to look at prevention in a slightly different way. Martin, could we hear from you on children and young people?
Thanks, Ben. Yeah, no, thanks to my group for again a really good conversation. The theme. A couple of themes that came out. The first was mental health, early intervention, supporting staff, particularly in schools, with the signs and symptoms of mental health to really get in there early, nip things in the bud, and be able to signpost to other services and other support. Within that conversation, colleges came up, so something about thinking about our further education colleges, about the good links that we need to build with them and how we might again signpost to specialist services. Although we did talk a bit about the funding and staffing challenges within all of that. We also talked in the sort of context of training, we also talked about trauma-informed approaches for children that may have adverse childhood experience, how we support our services be more trauma-informed. And finally, I'll probably mention substance misuse. So we talked a lot about prevention, eating well, but within that substance misuse and how do we support people with that around prevention, early intervention and support services. So a few things came up, and the other probably bit I would mention is transition into adulthood as well. So a few things from our group. Thank you very much to my group for that.
Super, Martin. Thank you to you and to your group. Rupi, am I right that Rupi, you were covering people with complex needs, people with long-term conditions, physical health and mental health challenges, and social needs?
Yep, that's correct. Thank you, Ben, and a huge thank you to the participants that were in our breakout room. So just 3 kind of high-level summaries. So the 3 kind of themes. One was around expanding what works. So there's a really good discussion about good examples of things we already have in our system, such as care navigators, multidisciplinary teams, and kind of voluntary sector organisations that really support people with kind of complex needs to navigate the system and also support them as being their advocate. So some some real kind of good practice, and how do we then spread that good practice across South East London and make that more consistent. The second kind of theme was around communication, and that was between clinical and care teams. So how do we get those teams to work better together to integrate care, and how do we get their IT systems to link up better, so we've got a more continuous story, but also about communication with our patients. So how do we help them understand what services are available, how do they access those services, and how do they do some of that navigation through our quite complicated health and care system. And then the final thing, kind of building on working with our patients, is having a more holistic approach, an inclusive approach to care. So when you're thinking about somebody with a long-term condition, it's not just their health issue that will be impacting their well-being. How do you think about the kind of wider their environment and the things that they're having to cope with on an everyday basis that would help support them? And a real kind of advocate for them will be their carer or a family member. So how do we make sure that they're part of these conversations? So building on that communication theme, really.
Thank you so much, Rupi, and to your group. And it's a really common theme from many of our conversations, including mine, just the complexity of the system and the challenges navigating it. And I was explaining to the group that, you know, when it comes to care for my children, my family, and my elderly parents, I often find myself just as confused as everybody else. And I wonder whether, in addition to signposting, there's also some sort of really radical simplification for some groups of care we could consider. Now, I think we have covered everybody except for James for adult mental health and me for primary care. James.
Fantastic, thank you, Ben, and thank you so much to the group I was with. Well, I think we could have stayed there for another half an hour, to be honest. It didn't feel like we were there for any time at all, so it just goes to show, I think, the depth and quality of the conversation was fantastic. A lot of what we discussed, funnily enough, has been covered by other people that presented back. Actually, some really, really common themes, especially around making sure we've got digital inclusion, we're looking at access and integration. I think some of the really, really strong messages we heard from the group was really about understanding our service users and people that live in our areas and receive our services as people, and not one size fits all. I think there was conversation about lip services being paid in the past to developing strategies, but actually it doesn't always translate into a service that's bespoke and really understands people as people, and would deliver the services that people need and want in the way and where they can access it. So it's really about location. We had a long conversation about does local services really matter, or is it the quality of services? I think overwhelmingly people want to be able to access services where they live, where they work, and at a time of day that suits them, because not everyone can get places within office hours. The conversation about integration, I think, was really, really loud. And A&E is not the default place for people in crisis. Once we understand what crisis is in mental health, A&E is not the place that people want to go. They want to go somewhere where you can get help with housing, social care issues, and your crisis support for mental health at the same time. That came across really, really loudly. But I think that trauma-informed approach and not treating everyone as the same was really big for us, and genuinely showing that we'll make a difference, and we're not just engaging with people to hear their views and then nothing changes. Oxley's example came up from one person on our panel as a really good example of a wellbeing hub that they'd set up with the voluntary sector that was starting to offer some of these alternatives to A&E in crisis. So I think really making sure we've got those sorts of offers in all localities would be key for us.
James, that's really helpful. And as you say, there is some interesting overlap in the themes, isn't there? Because in my group on primary care access to good quality primary care, there was a real theme around the need for primary care to meet people where they are and deliver services that work for individuals. And two people on our call, Tanya and Hadi, raised the real, the critical importance in primary care of delivering appropriate care for deaf people, for people from asylum seekers and refugees, and the need for models of care that really work for vulnerable communities in South East London. We had an interesting discussion of the pressures that primary care is facing, just in how important it is to find a strategic way through these, really substantial workforce crises. And Anne, who's a lay member, gave some really interesting thoughts on the need to develop effective team-based models of primary care to address these challenges and deliver better quality care for people. And the other really striking feature for me, and it was really powerful, we heard from two people who had faced genuine, really significant difficulties fighting their way through the system, getting access to primary care for more complex needs, including during the pandemic, and all of the difficulties that people often encounter when they're referred on and communication gets lost and they don't know what to do next. So all in all, a really powerful and insightful conversation. Now, we've got a couple of things to do before we wrap everything up. And thank you, everyone. I've been multitasking and I've been seeing the really interesting comments coming through on Menti, on the most important themes for your discussions. We don't have time to go through them now, but as before, this will be a really core part of the body of materials that we bring together over the next couple of months as we move into the next phase of our strategy. But if we could go to Mentimeter, we have got just a couple of last questions for you. First of all, following our conversations today, going to Mentimeter, what are the top 3 topics that you think we should take forward in our strategy? What are the things that you are most, most eager for us to keep in mind in the next phases of the strategy? And at the moment, this is not helpful. Oh, it's changing. So prevention, access to good primary care, really fundamental. And adult mental health also scoring highly. But I'm counting, and we've got 60 people on this call, and we haven't got 60 responses in yet. So very grateful for any further thoughts. I'm glad that both prevention and access to good primary care are scoring so highly, because we know that if we were to get those 2 right, the knock-on effects for our system could be, really hugely important. We know that a well-functioning primary care system, hugely difficult though it is to get to a really outstanding primary care system, well, that's the thing that will have such huge knock-on effects. But reasonably evenly split. Of course, there aren't very many children and young people on this call, and we do have to think about, and one of the things we will be thinking about is how we can ensure that the voice of others who we've heard less from between 5 and 7 on a Monday are part of the process, and we're going to do that. Can we go to one last question on Menti, for any, assuming that everyone has responded to that question? Our 5 areas are not our thinking on, the strategic priorities. To be honest, they're hugely broad, and there are too many of them, and we may have missed some really good potential areas for strategic action across South East London. So what have we not spoken about? What are the big areas of opportunity where we could do something dramatically different by working together across South East London? So go to Menti. What are the areas that we haven't covered? So health inequalities need strategic action. I think that's absolutely right. But we need to work out where would we have the greatest impact. Non-supportive groups, maternity also came up in our last conversation on Friday evening. So maternity, neonatal and postnatal care is an interesting area for us to explore, perhaps alongside women's health. In the chat, people are reinforcing the emphasis on access to a GP surgery when you phone. The homeless is an interesting additional area. I mean, if we really want to tackle inequalities, then one lens for that is to think about the people who we think are most left out. And you can think homeless, prison population, people with learning difficulties, refugees might be an interesting angle into that. Building the public health service, very much, I think, something for us to think through in the prevention space. One-stop shops, so access to health and social housing benefits, that's really exciting and interesting. We have pilots and sort of individual interesting examples of one-stop type shops in South East London and elsewhere in London. But is there an argument for being really systematic about a joined up approach across health, other public services, the voluntary sector, in our communities? I'm just looking and seeing a few others coming in. So neighbourhood teams and community development, that came up in a number of the conversations. And David Cooper, I see that it's nice to see you, David, but you're raising the staffing crisis and the huge challenges that we face there. So a few final comments coming in, but I am conscious that it is almost 7 o'clock on a Monday evening. Everything that you say here, we will reflect carefully on as we move into the next phase of the process. As Andrew said, we've got further large conversations like this over the next in the next week. And we have opportunities to continue the dialogue with you and our communities that I'll briefly mention at the end. Can we do one last Mentimeter question? Reflecting on your experience today, if there's one thing that the strategy should achieve, what should it be? A single thing, the single thing that you're most eager for the strategy to achieve. And once we've done that, I will ask our chair, Richard Douglas, to give a few closing reflections on what he's heard. So on Mentimeter, one thing the strategy should achieve: better collaboration, accessibility, flexible and compassionate care. Yep. So that's a very useful addition. You know, the fact that relationships and compassion matter in our system, I think, is important for our vision. Better health outcomes for all. GPs to be held to account. Yes, I think we also need to support our primary care workforce, but yes. Including residents as SEL employees, that's really interesting and chimes with work that my colleague Maria is doing on access to good work in South East London and how we can act as anchor institutions and better support our local economies. Discrimination, again, is a really significant issue. Improving access to primary care, non-digital access, digital exclusion is a theme that's been coming up throughout our conversations. You know, we probably do need to use online tools much better, but how do we look after people who struggle? As these last points come in, Richard, thank you so much for listening into this second conversation. What are your thoughts on what you've heard? And what particular issues do you feel we need to hold in our minds as we go into the next stage?
Thanks, Ben. And I don't want to spend a long time keeping people from their dinner on an evening. I guess the sort of themes, I can't summarize what people have said in the last 2 hours because there's so much stuff in there. But I guess a handful of things, and I guess things that were quite consistent with Friday's conversation we had as well. I think the focus on prevention across, and it comes through across each of the different areas. There was a prevention theme, but it actually came through on each of the different priority areas. And whipping right back to a comment someone made at the very start of this, I think someone said, take 1% off your budget and spend it on stuff that's not the NHS, that really deals with health issues. And I think there is a really big important issue for us here about where we invest our money and the extent to which we can get greater benefit from investing in areas we've not invested in the past. The second point I'd make is one of those areas, and one that's come through in every conversation, is how we relate to the voluntary and community sector, and an acceptance that, yeah, really this is not something we've used sufficiently in the past, and to think within that about how we best do that, recognizing different working methods, and recognize the financial constraints people are under. We've got to think that one through. One of the interesting tensions I think that came through in the comments people made were the tensions between local determination and not having a postcode lottery. And again, I think that came through quite strongly on Friday's meeting as well, where people said, yeah, reflect the differences in boroughs with their different priorities and different populations, but also this view that, yeah, we need to make sure there is a decent offer to everybody in South East London. And And then I guess a couple of things just around sort of getting the basics right in this. Accessibility comes through continually on this. Particularly, I've got to say, accessibility of primary care comes through consistently. So we must actually focus on that. And final comment, I think that someone said, yeah, focus on the basics and not always on the shiny and new things. And I think that's absolutely what we've got to do. There are a lot of things we can do just to get the basics of delivery far better than it is now without always having to invent something entirely different. So I think lots of food for thought there. As Ben said, this is part of a process. It's not the end. We're going to be doing a lot more engagement over the next few months. And hopefully a lot of you have the opportunity to engage in furthering this. Thank you all very much for your time tonight. I mean, these things don't work unless people actively engage, and you've definitely done that tonight. And as I must say, thank you also to the team for bringing this all together and for Ben for facilitating. But with 3 minutes to go, can I pass over to you, back to you, Ben?
Thank you, Richard, for that wonderful summary. So likewise, huge thanks to everyone for giving up 2 hours of their evening to this. We really, really appreciate your input and contribution. And as Richard said, we want to maintain a conversation and we'll find continued ways of doing so. In particular, we'll be sending you an evaluation form. We will be sending you to a link to our online platform, which is called Let's Talk About Health and Care, which has a specific microsite on the strategy. So that will be a way to continue adding your views. The recordings will be available online later in the week. And as Richard said, what we want to do is to continuing to engage you, including as we refine our priorities and start thinking about solutions in the autumn. And on that note, thank you again, everybody, and have a lovely evening.